For decades, surgeons have been removing lymph nodes during cancer surgery to save lives. But what if this life-saving procedure has been accidentally sabotaging our body's best weapon against cancer? New research is turning everything we thought we knew upside down. Welcome back to Mind and Marvel, where we explore the most mind-bending discoveries in science. Today we're diving into a medical controversy that could change how we fight cancer forever. Imagine your body as a city under siege. Cancer cells are the invaders trying to take over. Now, picture lymph nodes as the police stations scattered throughout this city, places where your immune system's defenders gather intelligence, plan attacks, and coordinate their response. For over 50 years, doctors have been removing these police stations during cancer surgery, believing it would stop the disease from spreading. And it worked. Millions of lives were saved. But here's the twist. Scientists have just discovered that these lymph nodes might be doing something far more important than we ever realized. They're not just catching cancer cells, they're training an elite squad of cancer-fighting immune cells. Today we're breaking down this groundbreaking research that's making doctors and surgeons worldwide reconsider one of cancer treatment's most fundamental practices. Let's start with the basics. What exactly are lymph nodes, and why did doctors start removing them in the first place? Think of your lymphatic system as your body's sewage and security network combined. Lymph fluid constantly flows through your tissues, picking up waste, bacteria, and yes, rogue cancer cells. This fluid drains through tiny vessels into lymph nodes, which act as biological checkpoints. When cancer starts in one place, like the breast or colon, some cells can break away and travel through these lymph channels. The nearest lymph nodes often trap these escaped cancer cells, like a filter catching debris. For decades, this made perfect sense. If cancer cells are hiding in the lymph nodes, remove them before they spread further to vital organs like the liver or lungs. Surgeons developed sophisticated techniques. They'd remove lymph nodes during surgery and send them to pathologists who'd examine them under microscopes. Finding cancer in the nodes meant the disease was more advanced, and patients needed more aggressive treatment, chemotherapy, radiation, the works. This information, called staging, became absolutely critical for treatment decisions. But here's what we missed. Lymph nodes aren't just passive traps. They're incredibly active hubs of immune activity. Inside each lymph node is like a bustling training academy, where immune cells meet, share information, and learn to recognize enemies. Recent research published in the prestigious journal Nature has revealed something stunning. Lymph nodes are specifically designed to maintain a special forces unit of your immune system called CD8-positive T cells. These are the assassins of the immune world, cells that can identify and destroy cancer directly. So what exactly did these researchers discover that's causing such a stir? The study found that lymph nodes provide a unique environment, almost like a specialized gym, where CD8 T cells get primed, maintained, and kept battle-ready. It's not just that immune cells pass through lymph nodes. They actually need to be there to function at their best. Here's the crucial part. When you remove lymph nodes, you're not just taking out cancer cells. You're demolishing the training grounds and command centers, where your immune system learns to fight that specific cancer. This becomes especially critical in the age of immunotherapy. If you've heard of treatments like checkpoint inhibitors, drugs with names like Keytruda or Opdivo, these are medications that basically take the brakes off your immune system, allowing it to attack cancer more aggressively. They've revolutionized cancer treatment for melanoma, lung cancer, and dozens of other types. But here's the problem. Immunotherapy relies on having strong, well-trained immune cells, particularly those CD8 T cells. And where do these cells get their training? You guessed it, in the lymph nodes. The researchers demonstrated in laboratory studies that lymph nodes don't just provide an initial burst of immune activity. They're essential for sustaining that response over time. Think of it like this. Removing lymph nodes is like canceling all the training camps and strategy meetings for your immune system's army right when you need them most. Now, to be clear, this research was conducted in laboratory settings, not yet in human clinical trials. But the implications are massive. It suggests that decades of lymph node removal, while preventing cancer spread in the short term, might have been weakening patients' long-term immune defenses, the very defenses that new immunotherapy drugs are trying to harness. Now, let's talk about what happens to patients when lymph nodes are removed, because the immune system isn't the only thing affected. Many cancer survivors experience something called lymphedema, chronic swelling that occurs when lymph fluid can't drain properly. Imagine trying to manage traffic when you've closed down half the highways. That's essentially what happens when lymph nodes are removed. Fluid backs up, usually in an arm or leg, causing painful swelling that can last for years, or even a lifetime. Some patients develop increased infection risk in the affected limb. Others experience chronic pain, numbness, or reduced mobility. For breast cancer survivors who've had underarm lymph nodes removed, something as simple as carrying groceries or lifting a grandchild can become difficult. These aren't rare side effects. They're common enough that every cancer center has physical therapists and specialists dedicated to managing lymphedema. And here's the kicker. While doctors were focused on preventing cancer spread, these quality-of-life issues were considered acceptable trade-offs. But what if we've been making a false choice? What if there's a middle ground? This is where the medical field has already started to evolve, even before this latest research. Over the past decade, surgeons have been developing more conservative approaches. Instead of removing all the lymph nodes in a region, something called a complete lymph node dissection, many now perform what's called a sentinel node biopsy. Here's how it works. During surgery, doctors inject a special dye near the tumor. The dye travels through the lymph system to the very first lymph node that drains that area, the sentinel node, like a guard at the gate. Surgeons remove only this one node and test it. If it's cancer-free, they leave the rest alone. This approach dramatically reduces complications while still providing crucial staging information. For some early-stage cancers, doctors are now using advanced imaging and careful monitoring instead of removing nodes at all. They're letting patients keep their immune system's infrastructure intact while watching closely for any signs of spread. So, where does all this leave us? Are we saying that removing lymph nodes is wrong? Not exactly. The answer, like most things in medicine, is it's complicated. For many patients, especially those with more advanced cancers, lymph node removal is still absolutely necessary and life-saving. The risk of cancer spreading through nodes to distant organs is real and deadly. Finding cancer in lymph nodes tells doctors the disease is more aggressive and helps them choose the strongest treatments. But this new research is pushing us toward a more nuanced approach. Instead of a one-size-fits-all strategy, the future of cancer surgery is precision and personalization. Imagine a future where doctors can map your individual lymph node network in real time during surgery. Using advanced imaging and maybe even molecular analysis, they could identify which nodes are actively fighting your cancer and which ones are harboring dangerous cells. They'd remove only the nodes that pose a threat, preserving the ones that are working hard to protect you. Some researchers are exploring ways to rescue or retrain the immune system after lymph node removal. New cancer vaccines, yes, vaccines against cancer, are being developed that could teach immune cells throughout the body to recognize and attack cancer, even without those lymph node training centers. Immunotherapy combinations are also being tailored to boost immune responses in patients who've had extensive lymph node removal. It's like providing remote training camps when the original facilities have been destroyed. The key insight from this research isn't that doctors have been doing everything wrong. It's that we're learning to see the body's systems as more interconnected than we realized. Cancer surgery isn't just about cutting out disease, it's about preserving the body's natural defenses while eliminating threats. For patients facing cancer surgery today, this research emphasizes the importance of detailed discussions with your surgical team. Questions like, how many nodes need to be removed, and are there alternatives to extensive lymph node dissection, are more relevant than ever. The medical community is learning that sometimes, less really, can be more. By taking a more conservative, strategic approach to lymph node removal, doctors hope to give patients the best of both worlds: effective cancer treatment today and a stronger immune system for the future. This story perfectly captures what makes science so fascinating and so important. For over 50 years, lymph node removal in cancer surgery saved countless lives. The doctors and surgeons who developed these techniques were heroes, working with the best knowledge they had. But science never stops questioning. By looking deeper into how lymph nodes actually work, researchers have uncovered a critical piece of the puzzle we were missing. Those police stations we've been tearing down. They're not just traffic stops for cancer cells, they're vital command centers for our immune system's ongoing war against disease. The takeaway isn't that old treatments were wrong, it's that we're constantly learning how to do better. We're moving from a sledgehammer approach to a scalpel approach, from blanket strategies to personalized medicine. And that's the beautiful thing about medical science. Every answer leads to better questions. Every discovery makes us rethink what we thought we knew. And ultimately, every breakthrough brings us closer to giving patients longer, healthier lives, while preserving their quality of life along the way. For the millions of people affected by cancer each year, this research offers real hope. Hope that tomorrow's treatments will be smarter, more targeted, and more effective than anything we have today. If this story blew your mind like it did mine, smash that like button and let me know in the comments. Did you know lymph nodes were this important? Have you or someone you know been affected by lymph node removal during cancer treatment? I'd love to hear your thoughts. Don't forget to subscribe and hit that notification bell so you never miss our explorations into the cutting edge of science. Until next time, keep questioning, keep learning, and keep marveling at the incredible complexity of the human body. This is Mind and Marvel, and I'll see you in the next one.